Hello everyone, I am Dr. Sudhanshu Bansal. I am a pediatric orthopedic surgeon practicing in Ludhiana, Punjab. Today we are going to talk about a topic which is a very common presentation in our OPD setups, that is bowing and knock knees in the children. Parents present to us their kids in different age group with bowed legs or knock knees. What is bow legs? Bow legs means when the knees are not touching and the ankles are touching, and knock knees means when the knees are touching and the ankles are not touching. The kid has broad base. So to understand it better, it is important to understand the types. It can be of two types, physiological and pathological. The physiological type means when a kid is born, the legs are in bowed position. It is normal to have bow legs when a kid is born up to 2 to 3 years of age. From 2 to 3 years of age, they start resolving to straight legs, then they start turning into knock knees. From 3 to 6 years of age, there is increase in the knock knees up to 6 years of age. After 6 years of age, this knocking reduces to the normal angles which an adult has. So any patient presenting to us between 1 to 3 years of age with bow legs is normal to have bow legs. So if it is symmetrical and it is not severe, we advise them to observe, have some multivitamins and wait for it to solve itself. Similarly, a patient presenting to us after 3 years of age with knock knees, and if it is symmetrical, not severe and not progressing very fast, then probably it is physiological. The other type is pathological. Any variation from physiological type, that means one leg is more than the other, the severity is more, the age is more than 6 years and the progression is too much, then it is called as pathological type. We have to work out the cause and advise the treatment accordingly. So the various causes of pathological can be like, most common is rickets, which is bone mineral diseases. Among various type of rickets, the most common type is deficiency of vitamin D. The other types can be, the other causes of the pathological type can be skeletal dysplasia, Blount's disease, post-infection, post-trauma. We have to work out the cause thoroughly to advise treatment accordingly. So a kid presenting early in an age, these kids can be managed medically depending what is the cause. Sometimes we need to consult pediatric endocrinologist for the treatment also. So medical treatment is advised to the kids who are in early stage and with less severity. Sometimes when there is a residual deformity or when the age is, when kid is near to their skeletal maturity, we need to intervene surgically. There are two types of basic procedure to correct this deformity surgically. One is guided growth and other is osteotomy. The guided growth, as the name suggests, in this procedure the growth is guided and assisted to correct the deformity itself. This is a minimally invasive procedure with a small incision. We stop the growth on one side of the deformity and we don't need to cut the bone. There is no much rest required. The kid can resume the normal activities very soon and there is no braces, no plaster is required. It is a very beautiful surgery because with a minimal incision we can correct a severe deformity as well. The other procedure when is done, the osteotomy is done when there is no skeletal growth is pending. The kid is near their skeletal maturity, the deformity is too severe. So we need to cut the bone and we need to put plates, screws, and the kid needs to rest until the bone unites. So it is very important to understand the importance of early treatment, because if we need to do surgical treatment, then guided growth is better than osteotomy. So it is rightly to understand the whole procedure is like right time, right diagnosis and right treatment is the cornerstone of deformity correction in this bowed legs and knock knees patient. Further information you can contact me, or to listen to the more videos like this you can subscribe to my channel. Thank you.